What a beautiful morning in New York City. It's great. It's nice. It's not humid. It's good to walk around. I was here yesterday afternoon from Washington, where it was also beautiful. How do we deserve that in July, these beautiful, nice, low humidity kind of days? So I'm Dr. George Isham. I'm the co-chair of the Institute Medicine Roundtable on Population Health Improvement. And I share that duty with David Kindig. On behalf of both of us, I'd like to welcome you to today's workshop. This workshop is being recorded and as well as webcast across the country, so everybody should keep that in mind. I also want to welcome all of you out there who are joining us on the web. The Roundtable provides a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from changes in the social and political environment for achieving better population health. Our vision as a roundtable is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by independent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and dependable resources in order to achieve it. So we've just released on the IOM website a new infographic. For those of you on the web, you can go there and hopefully download it right now. Based on the Roundtable September 2013 workshop. It was titled Applying a Health Lens to Decision-Making in Non-Health Sectors, and the infographic highlights examples of cross-sector collaboration that have a positive impact on health. The initial focus has been largely on public sector action, but the Roundtable plans to hold a follow-up workshop to broaden the exploration of public-private collaboration on policies that achieve co-benefits, including improved health. Copies of the infographic, which include a link, are available at the registration table for those of you here, if you haven't already got them. I see many of you have them already. As one of our major activities, the Roundtable sponsors workshop for members, stakeholders, and the public to discuss issues of importance to improving our nation's health. We have identified 6 drivers we believe are key to improving population health, and that are also areas where further dialogue and action can be stimulated. These 6 areas are metrics, policy, relationships, evidence, resources, and communication. And so today's topic, the business engagement improving population health, fits into that relationship bucket, as well as actually affects several of these different drivers. As you can see from our agenda, today's workshop is intended to discuss why engaging in population health improvement is good for business, explore how businesses can be effective key leaders in improving the health of communities, and discuss ways in which business can engage in population health improvement. So I think this is a particularly salient and important topic. Businesses across the nation are involved in every aspect of our communities and our cities and our economy, and they and the leadership that can be exerted by the business sector can be very, very powerful actors in terms of improving the health of the nation. And there are many ways in which that has occurred in the past, and we're going to explore in this workshop many ways that can occur going forward. Keynote presentation by Dan Buettner, founder of the Blue Zones, will provide evidence and examples of business engagement improving the health of communities. The panel presentations occurring at other points in the day will address the case for engagement, actions that businesses can take, and frameworks and strategies businesses can use to improve population health. The attendee packet available at the registration table includes bios of all the speakers and moderators, as well as a resource list. These provide an excellent overview of the relationship between health and education, as well as other topics. If you have health and business, rather. If you have any other logistical questions, please talk to our staff. The staff is wearing green name tags, so if you have any questions, any logistical issues or other issues or comments, please connect with the staff. So at this point, I'd like to welcome Jo Ivy Buford to the stage. She's the president of the New York Academy of Medicine. She has a complete bio in the materials, but Jo is particularly a friend and colleague of this topic, and it's just a real pleasure to introduce her, to welcome us to this really wonderful venue, and I want to thank you in advance for having us here. Jo?